Okay, we're ready to go. My name is Brian Eller, K-12 Schools Liaison Team Lead. Thank you for joining us again for another session for back to school guidance and overall K-12 COVID school mitigation guidance as well. Running through the agenda here, again, we received a lot of feedback on the Survey Monkey that came out last week, which was really helpful. It definitely changed the way that we're going to be doing a couple of things on this. I'm going to jump directly over to a PowerPoint right now as one of the reflective changes that was requested through that survey. Just a reminder to folks on the call, if you can please mute your microphones if you're joining us, just to make sure that we don't get any background noise. My team and I will manually go through and mute, but it does help if expedite those things if you can do that yourself. Here we go. So PowerPoint was up a second ago. Where did it go? Okay, technical difficulties. Apologies, everyone. We will get this up for you here in a second. Okay, here we are. So overview, we're going to go through guidance updates, vaccination updates, case counts, outbreaks, testing, and some other. We'll be going through it, addressing questions at that point in time. That is not updated. We have the new CDC guidance and we have a new template. Let me go back and pull up a separate PowerPoint on this. Holy guacamole, I'm on point today. Not really though. Okay, this is the appropriate one. So here's the guidance link from the CDC. We're going to post that in the chat so you all can access that. If you're unable to, for whatever reason, email us at eoceducation.pima.gov and we will get that link to you. The important things to know about this guidance is that the strong mitigation framework is a key piece of this. The CDC has supported our stance on 6-foot distancing to all extents within the classrooms, especially during rates of high community transmission. I'll talk about that in a little bit more detail further on in this presentation today. We do ask also that you continue to report your cases to the health department. Your cases and your close contacts at your school site, whether they're staff or students, do help us. Even if those students are remote, they do help us to make sure that we're keeping track of things, and especially outbreaks. We're really needing to know all of that information. Okay, so continue to make those reports. All the districts so far have been doing a very excellent job with that. We want to keep that same thread going as much as possible. So some of the visual graphic communications from the CDC on a 2-page PDF document the CDC put out to couple with their guidance. One of the other important things that you're going to see alongside with this is that the Department of Education also at the federal level has some really great accompanying documentation to go along with the CDC's guidance. If you haven't accessed that, go check it out. We're doing a condensed version of that, which I'll give you a brief preview on that. That's going through our communications team right now, and we'll get that out to everyone on this call for sure. Here's where, again, they're talking about the social distancing, physical distancing of 6 feet at all times inside of a classroom as a part of being really critical in terms of moving back to education. I think everyone on this call is aware the health department is moving away from recommending remote, hybrid, or traditional face-to-face instructional strategies. Those recommendations will be made by your governing boards, by your local educational authorities as a whole. What we will do as a health department is continue to highlight the mitigation needed to successfully do those things and to keep your environment safe. Cohorting and potting are one of the strategies that the CDC also talks about. So as you do make a move to go back to hybrid or traditional, really think critically about potting and cohorting within the groups of highest amount of potentially 20 that you can within your schools. I am seeing a comment from Ms. Miller that she's not seeing the PowerPoint. Is anyone else having that issue too? Are you all able to see the guidance slide that I'm on currently? Tiffany, if you can unmute and just tell me if that's happening.
Yes, I can see the PowerPoint.
Okay, I'm sorry, Miss Miller. We will send you a copy afterwards so you can see a copy of what everyone else is seeing right now. This slide is one of the key pieces where there is a communications component with the health department that you all need to be aware of, and it's in the high transmission red piece underneath the recommended implementation of mitigation strategies and K through 12 school learning modes by level of community transmission slide on the CDC. So under the high transmission red, this box in particular is a piece where it says middle and high schools in virtual only instruction unless they can strictly implement all mitigation strategies. So what you've heard from us on a couple of governing board meetings, perhaps you've seen it on social media, is that schools are within Pima County can go back to hybrid modes as long as they strictly follow the mitigation guidance that the health department has continued to put out. Since July, I think effectively, we've been very clear with the wash, wear, and wait as our mitigation strategies. Wash being referring to washing of hands, washing of frequently touched surfaces and sanitizing those surfaces. There's an update on that I'll bring up here in a little bit. Wearing of a mask at all times, except for in the lunchroom where social distancing, physical distancing must be adhered to, or on the playground where, again, physical distancing should be adhered to. Yeah, that's the piece I think is important to communicate, because I think when you look at this slide here from the CDC, what the impression is that you should stay in virtual only instruction during high transmission, which Pima County is in high transmission, but we are seeing a regression on that, which I'll provide an update on that here briefly. But again, what we're saying that the CDC is aligned with is that you can strictly implement all mitigation strategies. So please do that if you have middle and high schools going back. Continuing PCDHD guidance, we're going to be going through all of this guidance in more detail on this meeting and on the other Tuesday meeting on a weekly basis. We are going to be fully available to you to answer mitigation questions at the eoceducation@pima.gov email address, which Tiffany posted in the chat. We also will be doing future trainings to assist in implementation. So if there is a particular topic that you need more information about, email that over to us and we will take an extra minute or two or set up an entirely different webinar on how to implement that mitigation at your school site. But we can't do that if you don't email us, if you don't let us know what it is that you need, okay? So we will we'll be offering that guidance in the next coming weeks in more detail. Okay, over to K through 12 vaccination overview. So Sylvia and Azar have been really crunching through the second dose issues that we've seen from a lot of your districts, a lot of your schools. We're condensing that list down and we're handling those issues as best we can. The first dose is a completely different issue, and I'll provide an update on that here briefly. But overview of our goals: vaccinate the community as quickly as possible. As of 2/13, we had 7,899 folks go through Banner. We've had over 8,000 educators go through TMC's sites. We now, actually, this is updated. We've vaccinated with a first dose over 68% of our K through 12 population in Pima County in 1 month. Tomorrow will be 1 month since we opened vaccinations for K through 12. And to get through 68% of that population is pretty awesome. So we're feeling pretty good about that. That's been a combined effort from all the craziness that I know you all had to endure with that too. We do want to highlight that between 15 to 20% of a target population denies receiving vaccines. So that's a lot. We've seen that consistent with law enforcement, with healthcare professionals, with congregate care settings. There's about 15 to 20% of the overall population that don't want to receive the vaccine for various reasons. With the numbers that we're hitting, we're really close to getting to all of your educators on their first dose vaccine. Question from Leslie. Yes, send that over to Sylvia Vasquez. Sylvia, if you can drop your email in the chat there. Leslie, I think you have it actually. So connect directly with Sylvia on that, and Sylvia may have some updates for you on that, Leslie. later this afternoon. So try to touch base with her to get that in. Other vaccine information, again, FAQs, got to highlight those. The link is embedded right here in the PowerPoint. Everyone on this, on this webinar will get a copy of this at the conclusion before 5 p.m. today. So you got to do is go here and open up the hyperlink, and it'll take you to the FAQ page. Case counts, Tiffany. This is not the updated version. Let me get you the one that you sent me right here. And then if Tiffany, you can go ahead and unmute and walk through the case count updates when I get that slide up and ready. Boom, there it is.
Good morning. So as of 2/18, we have 3,508 cases. We have a downward trend. Actually, it says 5 weeks, but it's been a 7-week downward trend. And we are at 59 total outbreaks, which are epi-linked within the school setting. Over the last 14 days, we've had 6 basketball games, which have resulted in the quarantine of 16 teams and 1 confirmed outbreak from those cases.
Sorry, providing updates as Tiffany's talking there. Apologies for that, Tiffany. But it's actually been in the last 14 days, 8 basketball games have resulted in the quarantine of 16 teams. We've had 2 confirmed outbreaks on that. Whether we'll be doing some investigations on here soon. Thanks, Tiffany, for that update. And apologies for the craziness of that. I'll have to just make sure we get all that fixed later. Jump back to the other PowerPoint. Okay, here's this downward trend that I was referring to earlier. This is pulled directly from the Pima County data dashboard. Any of you can access that. This is not the current version. This was taken on the 12th, and you'll just continue to see this downward trend of cases in Pima County overall. For outbreaks, we continue to see, Tiffany mentioned earlier, there's been 59 outbreaks at this point in time since August. We continue to see evidence supporting strong mitigation in school sites, preventing outbreaks. There's been so far through the data that we've gone through, and we're going to continue to go through that. We've only seen 3 student to teacher transmission cases in those outbreaks, and that's all has to do with mitigation that has not been implemented properly, whether it was not using the mask or less than 6 feet. I know that there's been some discussion and there's been some studies that have cited a 3 feet social distancing. We've seen some studies in Europe that have resulted in that conclusion. The Pima County Health Department will not support that stance because the local data that I've seen on the 59 outbreaks, a lot of those relate to the physical distancing less than 6 feet. So we're not gonna support something that we don't see work here locally with our community, even if it's being recommended by some European agency or something like that. The CDC currently is at 6 feet social distancing on their stance, and we are aligned with that. I know it's difficult to do. It's going to be challenging, but that is a key way to keep your population safe from outbreaks at your school sites, along with masking with fidelity. ADHS dashboard, this was taken on the 11th. We'll have a new updated version of this today, but you can see from the school's dashboard, this continual downward trend that Tiffany was referring to on these various areas of percent positivity, hospital visits for COVID-like illness. PCHD, that hyperlink isn't working, so let me jump over to the web here. Our metrics and our benchmarks have changed significantly over the last couple of days. Again, if you're going to get your vaccine, if you haven't done it, if you have staff that haven't done it, this is the link to go to get that, the COVID vaccine one. But for our COVID-19 progress report, you can see that we're still in the red for disease data. For healthcare system availability and public health tracking and prevention, we are moving forward nicely right now. If you want to see what these criteria actually look like, pull the drop-down menu. It'll give you the numbers and the qualifications for what moved those metrics overall. I do want to highlight our lab testing availability and utilization being in the green. Our teams have done a fantastic job on that on the back end. It's under 24 hours now that notification is coming through for someone who maybe has taken a test. And Nikki, I will get you your question in just a second there. I do see your hand up. For the public health tracking prevention, same thing here. We're in progress for all of these areas, and you can see where those criteria actually meet. Jump back over to the presentation here. So that's the Pima County metrics. Percent positivity for Pima County, I will pull that data up in just a moment. Okay, testing. So testing is available, and we talked about this briefly on the last session that we did. Any of your teachers at any site can go and access one of the Pima County testing facilities at the various locations across county for free. We definitely recommend utilizing those services to the best extent possible that you can, especially with your teachers. If you have students that are in close contact situations, refer them to the testing sites to make sure that they do that. We do also have some Binax Now testing kits. I know a lot of districts are involved in the process for that, whether it's obtaining the CLIA waiver itself or going through the training to be able to administer Binax tests on site for students who are symptomatic or staff who are symptomatic on site. Those tests do need to be validated with a PCR if they're negative, which just is a quick referral process. If they get a negative test result and they're symptomatic, you can get them directly over to one of the Pima County testing facilities to try and get them in for same-day appointment and same-day notification on that. Nikki, if you want to unmute and go ahead and ask that question. Thanks for waiting.
Hi, Brian, can you hear me?
Yes, I can. Thank you.
Oh, terrific. When you give those stats about schools and outbreaks, are you keeping the students that are in sports separate from the classroom students?
So the way I'm hearing your question is, are we as a health department separating sports students from classroom students? Is that correct?
Yes, that's my first question. Yes.
Yes, in the tracking of it, we are but it's all cumulative in terms of the overview of outbreaks. We are separately tracking sports though, because of our consistent guidance in reference to close contact sports and the inappropriateness of running those specific activities during a pandemic. We know that that's not that there's reasons that that's not always being adhered to. But we do track those things separately, and we have several reasons why we're doing that. In fact, HBO is actually going to be working with us to do a release on that through one of their sports programs here fairly soon. As far as I know, we're one of the only counties that is really tracking detailed information on that.
Okay, so Brian, when you say there's 59 outbreaks, those do or do not include sports?
They do include sports. Now, Nikki, please remember that the outbreak is just reflective of the event. That does not, so within those 59 outbreaks, there are an even more number of cases, right? So each outbreak has 2 or more cases associated with it. Some of those outbreaks have up to 20 plus cases, and those are just positive cases. So does that kind of help answer your question a little bit more?
Sure. So my final question is, so is Pima County taking a stance on students that are in sports that they still should be remote, or is there no words on that?
The county as a health department, we can make recommendations on it. We can strongly suggest it. We have no legal authority to enforce anything beyond that. Our stance is that we shouldn't be playing basketball. We shouldn't be doing wrestling. Softball, baseball, track and field are all appropriate, but we just should not be doing those other things. And the data that we've seen just in the last 2 weeks from basketball games strongly support those claims.
Yeah, it's a tricky situation with AIA. So I hear what you're saying. You're not recommending it. However, if the students are continuing to do sports, is there any recommendation that they should be remote and not in the schools?
They definitely should be potted, and they should definitely be not in a school setting if they're playing close contact sports. And what I'm hearing you say, Nikki, is that you all need some guiding documentation on that. So we know we're putting out some reinforced sports guidance here in the next week. We're going to make sure we include some language around that. So Stuart, if you're on the call, if you can just take a note of that, we're going to make sure we meet that request from TUSD. Thanks, Nikki.
Thank you.
Okay, I'm going to move through the rest of this and we'll come back and address a couple of other questions. You all know these graphics. I'm not going to spend a lot of time on them because I think you should be pretty familiar with these at this point in time. Back to the agenda really quickly. New team. So if anyone from the new team, I know y'all have a lot going on right now. If you can just turn on your camera really quick and we'll do a quick introduction. Sylvia Vasquez, many of you have probably already heard from Sylvia. Sylvia's been working with Azar Jamal from the library on getting all of the vaccine-related stuff taken care of on K through 12, which has been a huge assist. What previously would have probably taken me 2 weeks to do, that team has been able to really hammer down into and spend all workday addressing those questions. So Sylvia has been super helpful with that. If you have K through 12 vaccine-related questions, please reach out to Sylvia Vasquez. She can help address those first shot, second shot needs. And I'll go over a press release here in just a brief minute to talk about some of the issues with the first vaccine doses that haven't been administered yet. Stuart Sloneker is a former teacher with 30 years of experience in the educational systems here locally in Tucson. Stuart's going to be working specifically on a lot of the sports mitigation guidance and tracking in more detail a lot of those sports-related outbreaks, sports-related quarantines, and sports-related cases. We are going to be sharing that information publicly out. We're not going to be doing any personal identifying information. We're not going to do any district shaming. So you're not going to see your district names attached to any of that, but those numbers in aggregate format are going to be put out because we as a county feel very strongly about contact sports and the need to not do those things right now. Again, we can support baseball, softball, track and field. Those kinds of activities are justifiable in an outdoor setting. But just knowing in the past 14 days, we've had 8 games that have resulted in a full quarantine of 16 teams because one positive case played in that game against the other team. That tells us that there's a lot of things that are just impossible to mitigate, and it's not good to do those things right now. Dixie Siegel, also a former teacher, has got a lot of exceptional education and alternative education experience. So she'll be assisting with case tracking and developing some mitigation guidance specific to those populations. Kristen King comes to us from a pretty robust background of working in the nonprofit sector, also in exceptional education mitigation and former testing experience with Wisconsin, the state. Kristen will be leading will be coordinating primarily with Julie and Casey, who's, if you've done any of the Binex testing process, then you know those individuals. Kristen will be the point of contact for our schools team to get those things up and running, and will also be our local CLIA expert, which is the waiver that you need for a certified laboratory. So anything testing related to schools, Kristen King will be your point of contact. And we'll make sure to include their emails out on the notes on this agenda that'll get sent out after this meeting today. Again, highlight our YouTube channel that is being up to date. You'll see this specific recording today dropped on that YouTube channel link. If you need it, I'm going to drop it in the chat right now, so you can feel free to access that and review notes later for that. All right, let's go through some of the questions with our 5 minutes remaining. Percent positivity for Pima County. I'm going to try to pull that up while I'm getting the other questions answered here. After getting both vaccines, should we get regular testing done? For the first 14 days after your second testing, Ms. Palmer, only if you're symptomatic. So if you are, The vaccine efficacy is after the second dose, the 14 days after that second dose, you're still possible. It's still possible that you're able to acquire COVID during that 14-day period. So we just recommend monitoring for symptoms. And if you do develop symptoms, go seek a test at one of the Pima County testing facilities. After that 14 days is cleared, you have 90 days of full efficacy with the vaccine where you're exempt from quarantine. Obviously isolation because you wouldn't be a positive case. That does not mean that you slow down on your mitigation practices though. Physical distancing and masking are both still a need to do thing, even post-vaccination. So important things to note there, okay? Next question, Vail school staff log into my chart account to see status shot or register now receive a message they can no longer use my chart. This is because U of A is now connected to the state health department. Great question, Mr. Vantes. So a couple of things to do with that. So I'm going to pop this press release into the chat. We've had a serious delay on vaccine supply from the state. The snowstorms on the East Coast have grounded the planes that were supposed to deliver vaccines out to us in Pima County. So anyone trying to get a first dose, it's going to take them a while to do that. The second dose has all been prioritized through the county admin declaration. So if there's folks that are needing that second dose that haven't gotten connected to us yet, please get them connected over to Sylvia. And we'll make sure they get one of those slots. Here's an overview of that press release in general. This will give you an idea of what's going on and why teachers are not able to schedule their first dose for a considerable timeout. I believe my spouse just made her appointment as a teacher, and it wasn't until March 26th that she was able to get her first slot. So I know the concerns intimately. They should still be able to schedule my chart at the Tucson Convention Center, but if they're trying to schedule at U of A, yes, they have to go through the state health department website, which if you do an ADHS vaccine registration Google search, it'll take you to this link. And then go right here, create a new account, and then log in to book and schedule your vaccine appointment at the University of Arizona. Again, it's going to take a while for that to go through, okay? Perfect. So yeah, Lisa, it's probably related to the moving to the new system. But yeah, we'll if you can send that to Sylvia as well, and maybe Lisa, we can even schedule a call to troubleshoot that today as well. Janelle, the YouTube channel is shareable and open to the public, so feel free to send that link out. If there's a specific video that you want to share out with anyone, please do so. You can share it out with parents, you can share it out with guardians at your school sites. All right, we are at 11:30, which concludes the session for today. I'm going to stop recording. You're going to see